From Penn State Health, Milton S. Hershey Medical Center, this is Ask Us Anything About New Year's Resolutions. I'm Scott Gilbert. Well, for many people, the New Year sparks a newfound sense of self-improvement. However, those New Year's resolutions, many people find they're more easily broken than kept. Now, here to share some tips with us on how to break bad habits and start some good ones is Dr. Carly Smith. She's a clinical psychologist here at the Medical Center. Thanks for making the time today.
Sure.
Let's start by talking about those keys to setting a reasonable resolution because, let's face it, I think that's the first step in the process. You can't keep a resolution that's unattainable.
Yeah, I agree with that. I think one of the things that people really struggle with is how to set their own resolutions instead of the ones that they hear a lot, from their friends or on the news, and really choosing one that's relevant to them.
And kind of the societal pressures. They think, well, what does society want me to do versus what I want to do? Well, how can somebody kind of zero in on what's appropriate for them? What's the right resolution for them?
Sure. Well, I think really looking at the areas of your life that are really not going the way that you want them to, and figuring out if there are small, kind of reasonable changes you can make that might move you closer to the direction that you want to be headed in. Things that are really important to your own values or who you want to be as a person, that's a great place to look.
And we'll touch on an acronym in just a moment that maybe can help you set a resolution. But first, I want to remind you, you're watching Ask Us Anything About New Year's Resolutions from Penn State Health. Dr. Carly Smith welcomes your questions. Just add them to the comment field in the bottom of this Facebook post. Whether you're watching this interview live here on Thursday or if you're watching it on playback, we'll track down some answers for you, and we'll add those as comments to the comment field as well. So, Dr. Smith, I want to talk a little bit about that acronym, SMART. Now, this is something that I think a lot of us who work in an office environment may know from a completely different setting, and that is annual evaluations.
Okay.
You set SMART goals, stands for specific, measurable, achievable, relevant, and time-bound. Let's break that down a little bit.
Sure.
Let's start with specific. What do we mean by setting a specific goal versus some sort of lofty one?
Sure. All power to the people who choose a lofty goal, but they could still be specific. So, you often hear goals like, I'm going to eat better or exercise more, drink less, things like that. When we think about specific goals, we want to hear what exactly that looks like. So exercise more might be like, I'm going to go for a walk every day, and that walk's going to be about 15 minutes long. And that's a much more specific goal. And what's cool about that is when you hit it. So you have this ability to check it off the list, and checking things off lists that never gets less fun even as we get older. It feels good.
And the M in that acronym is measurable, which you just touched on. 15 minutes a day, that's measurable. But you can't just say, I'm going to walk every day, because that's not measurable.
Yeah, and measurable, often a really good way to think about that is you want it to be something you're doing rather than something you're not. Because if you can say that you've done it, it's easy to kind of track, yes, I've done this each day, and as soon as it's happened. Rather than setting a goal that says, okay, I'm not going to eat junk food. You kind of can't get to that goal until the end of the day or the end of whatever time period you set. So measurable is often much better done in, I can tell when it happens, not wait and wait and wait and wait. Okay, it didn't happen.
And when we talk about attainable, the A in that acronym, I guess that means not saying, I'm going to lose 60 pounds in the next 2 months or something outrageous like that.
Right, yeah. And when it comes to weight loss, we have experts here that can set really attainable goals. Typically you hear the convention, no more than a pound a week of weight loss. Your doctor might be able to tell you a body, percentage of your body weight. But when I think about attainable, I often think about what it is about your environment that's going to make it possible. So if I set the goal here in central Pennsylvania that I'm going to visit the ocean every day, that's probably not attainable. It's
good luck with
that. Right. Yeah, I might not make it into the office as much. But so you want to kind of look at the types of things you have around you that might support you get closer to that goal or make it harder to do a behavior. And that is really a way to kind of take stock of what's attainable.
And when it comes to relevant, the R in the acronym SMART, I guess this goes back to what the right resolution is for you may not be the right one for me.
Absolutely, yeah. The places I've really seen people do wonderful things is when they set goals that have a really deep meaning to them. So, they want to be able to make it to a really meaningful event. They want to be able to run a race with a family member, and then they have this kind of meaningful experience that helps them continue to find motivation even when, they might be having a crummy day or unexpected things are popping up that are really getting in the way of their plans. That you can kind of look inside and say, okay, I'm really motivated to do this. And that relevance is something that other people probably can't do for you. You have to know.
Yeah, finding that inside of you. And time bound. What do we mean by time bound as opposed to when we talk about attainable or an achievable goal? What do we mean? I guess it involves obviously a period of time, but
yeah. So time bound can be a place that actually helps you do more than you think you can. So a lot of times when people think about setting a resolution, it's kind of implied that it's forever. I will start exercising and I'm going to do this forever. And that can be really daunting, especially when you're trying to make changes to really ingrained habits. But if you can say something like, you know what, I'm going to do this new routine. I'm going to take a walk every day and I'm going to do it for a month. And then I'm going to see how I feel. And having this kind of understanding that, okay, this might be really hard, but it has an endpoint where I can take stock if it's working, it makes it easier to do something harder.
You're watching Ask Us Anything About New Year's Resolutions from Penn State Health. I'm Scott Gilbert alongside Dr. Carly Smith. She's a clinical psychologist here, and we welcome your questions. If you've set a resolution and you think you might need to tweak it and you want to know how to do so, put a comment in the comment field here. Even just share your resolutions with us, too. Feel free to just type in the comment field and let us know what you're resolving to do here in 2018. And that actually leads me to another question of accountability, too. By sharing your resolution with people, whether it's in this Facebook post or even with friends and kind of getting them involved, how can that help things?
Well, I think it can be really helpful for a lot of people. I think one of the ways that you really have to know yourself in getting other people involved is know that for some people, disappointing other people or feeling like other people know that they didn't meet a goal, that can be so guilt-inducing or embarrassing that it actually is not inspiring. It's kind of counterproductive. But having people know your goals and even a step further, knowing what they can do to encourage you is really helpful. The other thing that I might suggest in terms of knowing who you're enlisting as your support is try to find people who will be impressed and supportive of your goals. So if I'm starting to, develop a running habit, I might not want to join a group of, 7-minute milers and try to keep up. You want to choose peers and sources of encouragement who are going to be impressed and supportive of what you're doing.
It goes back to attainable. Don't say I'm going to run a marathon in February if it's currently January.
For some people, that's an attainable goal. If you're already clocking 30 miles a week, go for it. Run that marathon in February. But it's knowing what's attainable for you in that case.
Good luck to them. Sounds like a lot of effort to me. I don't know, man, because I'm not that great of a runner. And we talked a little bit about the importance of making sure you choose something that's something you want to change. How important is it also, though, to make sure you cut yourself some slack? Because, we're all going to occasionally let it slip. If we say, I'm going to run every 2 days, we might let 3 days go by and not run. Does that mean resolution over? Probably not, right?
Yeah. I often talk with my patients about this. We set really specific behavioral goals, knowing full well that they might not happen. They might not achieve them. But, rather than get a case of, I guess, on this particular camera, I might say the forget-its, we try to learn from those mistakes. When it didn't go right, then there's a ton of information there. Okay, you had the intention. What are the exact things that got in the way that derailed you? And those kind of failures are a huge source of information to do it better the next time or even achieve the goal the next time.
And we talked about relying on peers and family, and what about support groups? Are there is that an option for people who are trying to either quit some habits or pick up others?
Oh, absolutely, yeah. Wisdom of the crowd and wisdom of your peers can be better than any doctor telling you should do this. Having that support and having the accountability is one thing, but really kind of working with people who are going through the same things can be incredibly validating and give you this source of motivation and sense that, okay, this is something that I can do. I know there's other people working on it. It's really valuable to have those peers.
Even if at least just to show you I'm not alone in doing this. There are other people with the exact same plight.
Yeah, absolutely.
You're watching Ask Us Anything About New Year's Resolutions from Penn State Health. Dr. Carly Smith welcomes your questions. Just put them in the comment field below this Facebook post. And if you find this interview helpful and useful, as we hope you do, feel free to share it on your feed to help us reach even more people with it. Because let's face it, a lot of people trying to set resolutions this time of year. And I've heard that there's been some research done about certain amounts of time that if you keep a resolution or if you stick with a habit, then the likelihood that you'll stick with it for another year, 6 months, 5 years is a little higher. Can you talk a little bit about that?
Yeah, so there's a pretty broad range of time frames supported by research. Some say as little as 2 weeks, some say it's, closer to 2 months. And what I would suggest is to kind of take this idea that, making a new behavior a habit is the goal. I would suggest taking that idea maybe a little lightly, because a lot of times the things that we do in our lives that are most effective, it's not because they're automatic or just kind of ingrained and we do them without thinking. We kind of have to choose them over and over again. Like, I choose not to raid the pastry case at Oban Pan every morning. I choose that every morning. And so having this idea that it's automatic, it's cool. It does make things stick, and kind of adjusting your environment to make a behavior more likely, or perhaps take less, resistance to overcome an old habit. That's great. But in terms of making a behavior automatic as the end goal, I don't know that that's always necessarily the right way to think about it.
If a patient comes to you and is in total frustration, just like, I can't quit smoking, or I can't do this, I just can't. They just use that word can't over and over again. What do you offer? How do you try to encourage them? How do you try to get them back on track toward their goal?
Yeah. Well, so probably the first thing I would say to a patient like that is it certainly seems the case that you haven't been able to. We can look at your behavior and you're right. You're still smoking and you don't want to be. And so letting go of this idea of I can't, there's some kind of inborn quality of me that I will always be a smoker and this is who I am. The first step is kind of letting go of that and looking at the behavior as one that is supported by some sort of reinforcement in the environment. Something about the behavior is pleasurable or gets rid of a negative feeling, and really just approaching it like two scientists working together. What are the variables that lead to this behavior? How can we change them that maybe the behavior changes? And really starting from there. I mean, the first step of really making any type of change is having some sense of hope that it's possible. And I often tell my patients that I'm totally willing to be the only one who has hope, at least in the beginning. I expect them to carry some of the hope eventually, but I'm totally fine to carry all of it in the beginning.
When it comes to picking up a new good habit, such as exercise, it seems a lot of that must come down to time management. But what's your advice for people for time management when we seem to be surrounded by what many consider to be a culture of busy?
Yeah. Well, I mean, it is kind of being realistic about what the demands on your time are. So if you're setting this goal of exercising every morning at 6 a.m., but you've got 3 kids to get up and get on the bus, and that's exactly when they're kind of all roaming around the house. It's being realistic about what part of your time is truly manageable versus what kind of belongs to other people or might be taken in a direction you didn't intend. Certainly setting goals that can be worked into a busy day is really helpful, because a lot of people, for example, with habits like exercise or meditation, they have this really strict image of, okay, exercising is only exercising if I go to a gym for an hour, and that's the way exercising looks. And being able to be flexible about what that actually means and how it could fit into a busy day.
And maybe it's walking the dog in the morning.
Oh, absolutely. Yeah, the dog would certainly be happy about that.
Absolutely. Yeah, there'd be a resolution for the dog for 2 of you. You're watching Ask Us Anything About New Year's Resolutions from Penn State Health. What is your resolution? What have you resolved to do in 2018? Go ahead and add that to the comment field below this Facebook post, or even your questions for Dr. Smith here as we begin to bring things a bit to a close. I guess, is there such thing, do you ever run into patients who try to set too many resolutions? That is, I'm going to quit doing this, this, and this, and at the same time, I'm going to start exercising, I'm going to start eating better, and it's all going to happen in 1 year.
Yeah. I do run into that at some points. And what I'm on the lookout for there is and I share this with the patients that have those types of long goal lists, is, you only keep doing the things that are reinforcing in some way. And so if you've got this laundry list of things and you're only hitting, 5% of them at any given day, it's just the rest of them are going to fall by the wayside. And having that long list tells me that they're ambitious and they're motivated and they've got lots of energy and hope about changing. And if we could funnel that into 1 or 2 of those goals, nail those, and then we can go back to the list. You don't always have to do all of them at once.
Right, exactly. Setting priorities. Very good advice. As we wrap things up here, any parting advice for people, anything we didn't touch on that you want people to know as they go charging into 2018 with their resolutions?
Sure. Yeah. We treat January 1st like it's this magical day where we get reset, but your body and your habits, they don't know what date it is.
It's artificial, right? It's an artificial deadline.
Yeah, I mean, I often approach a new year with new hope, but I started doing something different, made a resolution for myself, and I started December 30th, and then I wandered away for a little bit, and then I did it again. Like, you can start and stop and restart. There's nothing magical about that date. So, hey, we're into the first week of the new year. It's totally fine to start a new resolution at this point.
It's like, be flexible and forgiving, and don't just view it as, well, that's broken. I guess I'll have to wait till January 1st, 2019, and then I'll try it all over again. We have a question from Alicia. She's asking Dr. Smith, when trying to do something new, so you find rewards or punishments are more effective in actually getting people to change. I think she's asking, do you find rewards or punishments are typically more effective in getting people to actually change?
Oh yeah, it's I'm just kidding. It's punishment through and through. Just kidding. It's rewards. Yeah. It's very often people have this kind of punishment mentality of like, oh, I messed up. I'm such a loser. Letting that stuff go is so helpful. We respond, all humans, and that dog who likes to be walked as well, we respond so much better to rewards. And knowing what is rewarding for you, that makes the behavior more likely, that is like half the battle, I would say.
What about putting that reward on the calendar, right? Like, okay, if I run 3 times this week, I'm going to get ice cream on Saturday.
That might be an interesting goal. Maybe like a low-fat ice cream.
If I must.
Yes, indeed. But yeah, having your reward be something that actually is meaningful and feels like a celebration to you. For a lot of people, there's apps that are about tracking and like scoring points. That is really reinforcing to some people. That doesn't really do it for me. So knowing what it is that really makes something rewarding, it's great.
It only figures, right? New Year's resolutions, there's an app for that.
Yeah. Oh, there's many apps for it.
Many. Mm-hmm. Dr. Carly Smith, thanks for your time today.
Sure. Thank you.
Good talking with you. Dr. Smith is a clinical psychologist here at Penn State Health Milton S. Hershey Medical Center. I thank her for her time, and we thank you for yours in watching Ask Us Anything About New Year's Resolutions from Penn State Health.